treatment of bone cancer or bone sarcoma. It is a rare disease and disease of children and youngsters, mostly under the age of 30 years it starts and appears in the long bones of the skeletal system, that is the thigh bone or the upper arms, vertebral column and the shoulder area and the hips, joints and the hips bones. So this is the field of orthopedic oncologist, especially pediatric orthopedic oncologist, because mostly it starts in childhood. There are two types, osteogenic and chondrogenic. The usual cancer or the cancer or sarcoma of the bone is osteogenic sarcoma, and next are chondrogenic and Ewing sarcoma. So these starts within the bones as a primary sarcoma, and they start growing within the cavity of the bone or bone marrow and also in the matrix of the bone. So in these, the bone cells and the connective tissue, which consist of nerve endings and the vessels, they are involved. Mostly it is inherited, that is defective gene is responsible for production and appearance of this pediatric or youngster sarcoma in the bones. As it mostly appears in the long bones, so it is a debilitating disease. Debilitating disease, the person cannot perform his normal function, even just walking becomes difficult. Movements of the joints are very painful due to swelling and lump formation in the area of the sarcoma or the bone cancer. Traditional treatment is the same one like the other types of cancer in human body, that is the radiotherapy from external source and internal sources or methods. The machine is outside the body of the patient that transmits the high voltage radiation of X-rays and other energies to kill the cells of the cancer in the bones. Next is the internal source, that is we inject the radioisotopes, active pellets or the seeds particles that travel through the blood and approaches and get access in the area where the bone cancer is surviving. So there they start producing the radioactive radiation and kill the origin of the cancer cells. So it is an internal radiation method. Next is the chemotherapy. It is a single or a group of medicines are used in routine and traditional treatment of the cancer. This is a chemotherapy plan, but in this sets of medicine there is also side effects. Not only the cancerous cells are damaged, but the surrounding normal tissue, they also suffer to some extent. They may be damaged. So, due to this reason, the researchers has manufactured the targeted chemotherapy. And this consists of the medicines which only select the diseased cells, cancerous cells, to attack them and to kill their DNA, which is commanding to start aimless and countless production of the abnormal cells. So this is targeted therapy. These medicines, they are given orally, systemically, through the IV routes also. In addition to this group of medicines, there is also another group which is called as immunotherapy. This group of medicines do not have any action against the direct action against the cancerous cells in the bone or anywhere in the body. But these medicines, they boost up the, augment the, potentiate the activity and power of the immune system of the body, human body, which consists of CD4 cells, T cells, B cells, lymphocytes. They all cells, they fight against the any abnormal thing in the body entering. So they try to fight against these cancer cells. So these medicine, immunotherapy, these medicine, they boost up the function of the immune system cells, but also the vital role which is played by this group of medicine is they detect the location of the cancer, because cancer cell has a capability and a property to make an wall against the site of cancer. They produce a protective wall around the cancerous tumor. So they try to hide from the defense system. These medicines, they damage that wall, make entry, doors for the entrance of the immune cells. So they also act as a detector for the immune system of the human body to approach or to get entry at the site of the cancerous or the tumor to kill them or fight them. So this is the function of the immunotherapy.